A 28-year-old woman presents with a 3-year history of recurrent headaches. She says the episodes are typically triggered by hunger, mental stress, physical exertion, lack of sleep, and although many times the trigger is unknown. She describes her headaches as unilateral, severe, throbbing, and aggravated by movement. Patient says that each episode usually lasts 6 to 24 hours and is often accompanied by nausea, vomiting, and intolerance to light. Which of the following brain regions has no role in transmission of the pain signals for this patient's symptoms? Dorsal raphe nucleus, red nucleus, locus ceruleus, nucleus raphe magnus, and periaqueductal gray matter. Okay. Already diagnosed this patient for me, having recurrent headaches triggered by hunger, mental stress, physical exertion, lack of sleep, and even sometimes it's not even known. Typical headache description is unilateral, severe throbbing, aggravated by movement, sensitive to light, nausea, vomiting. Yes, it's migraine. Great. Right, so it's a migraine headache. Typical, very typical presentation. Now what they're asking is not even what is migraine and like what is its treatment. They're just asking which of the following brain region has no role in the transmission of pain signal. So basically this question is more based on what are the nucleuses or the brain areas that are involved in the pain pathway and which ones are not involved in the pain pathway. Okay. Now talking about migraine, it is kind of a vascular issue, but because your face and your upper part of your frontal and the vertex is kind of transmitted by the V1 branch, which is trigeminal, it kind of involves the trigeminal-vascular kind of the pathophysiology we talk about, right? And it's the pain pathway. So basically, this trigeminal nerve, it carries this pain fiber through the trigeminal ganglion. Simple, right? From there, it's going to synapse with the second order neuron in the spinal trigeminal nucleus, which is in the midbrain. Sorry, in the brainstem. The spinal trigeminal nucleus, if you look at it, it's more like a snake-like structure over the lateral part of your brainstem. So it does involve your brain, your midbrain, your pons, and your medulla. Okay, so it's going to synapse over there. From there, the second order neuron is going to cross the midline and it's going to go up into the thalamus. Thalamus is the main relay for pain and for all kind of sensations, right? From there, the third order neuron goes directly to the cortex, the postcentral gyrus, right? Now, in this whole pathway, there are a lot of other trajectories that comes in, a lot of other nucleuses, the neurotransmitters, areas such as hypothalamus, the periaqueductal gray matters, all of these are having trajectories. You kind of get sensations and like signals from all over the place, and it's a little bit complex than what we think it is. And that's why we just have to remember which nucleuses are involved in pain modulatory pathway and which ones are not. If you have just an idea like which ones are not involved, because there are only few of them, you will be able to easily answer this question. So just for this one, the answer is red nucleus. Honestly, if you ask me, I know that raphe nucleuses have serotonin and like locus ceruleus contains norepinephrine and periaqueductal gray matter. I know it's involved in pain pathway. So I only know that that one is involved in pain pathway, not the other ones. But then we had to answer one that is not involved, right? I know serotonin and norepinephrine, somehow it kind of modulates, it kind of helps in that pain kind of processing because of the endorphins and all kind of signaling kind of came to my mind. So what I thought was what was not involved, and that's why I picked red nucleus. That's how I answered this question, I'm telling you. So red nucleus is a part of midbrain that is involved in motor coordination. It is only and only motor coordination, has nothing to do with sensations and the pain pathways. Okay, so that is why red nucleus is the answer.
Thanks for watching. Please give a thumbs up and subscribe for more.